Local and live. Covering Franklin and Washington counties, it's Let's Talk TriState.
Welcome to Let's Talk TriState. I'm Katie, and our first guest today, we have Dr. Sean Shin, who is a neurosurgeon at Meritus Neurosurgery. Dr. Shin, thank you for being here with us today.
Thank you for having me.
I have so many questions I want to ask you. I've never interviewed a neurosurgeon before, but let's just go ahead and start at the beginning.
All right.
What led you to pursue neurosurgery as a specialty?
That's a really good question. And I kind of have an answer for different persons who ask me because there's so many good reasons for it. But I'll try to kind of summarize the two biggest reasons, right? When I was a kid, I wanted to be a doctor and just to help people. But then as I went to med school, you had to pick a specialty. Mm-hmm. You can't just do everything. But I was interested in everything. So I was inspired to do as much as you can intellectually, something very interesting and challenges your mind. But at the same time, I knew I was good with my hands. So I want to do something with my hands to try to fix people with my hands. So to me, what's something that I can have both? Something that challenges my mind to the max, and also that challenges to my hands. So I thought brain surgery, what else could be more perfect combination of intellectually stimulating and technically challenging?
Was there a specific moment or experience that when you were going through med school where you thought, yes, this is it?
Right. Unfortunately, I don't have a great, awesome story for that.
Did you always know?
No, I didn't. That's the thing. A lot of people they met somebody, they have family, they had a major experience that impacted them. For me, I didn't have that experience. So I was trying to figure out what is for me. So actually, one important book I read, the first non-medical book about medicine, basically not a textbook I read. It's called, if you get a chance, it's a great book. It's called When the Air Hits Your Brain. Okay. Written by a neurosurgeon. And I was reading that maybe at the end of my second year of medical school. Most people going to neurosurgery, they know way ahead of time. I was way behind because I wanted to figure out what I want to do. Yeah. That book was talking about what it was like going through becoming a neurosurgeon and his experiences. And I read the stories about in that book, and some of the stories really moved me to tears. And I thought, oh my gosh, I've never felt so galvanized, so inspired to be a specific doctor. Before that, I knew being a doctor is the right thing to do. My dad wanted me to be a doctor, being a typical Asian person, right? And I knew I want to help people. But that book just really, really inspired me to the neurosurgeon I want to be today. So,
When the Air Hits the Brain, is that the name of it?
Yeah, When the Air Hits Your Brain, yeah.
Where did you study?
So I went to medical school in Western University of Health Sciences. It's outside of Los Angeles. And then I did my residency at Cooper University House, which is in New Jersey. Then I did a fellowship at City of Hope, which is a cancer hospital in LA, where I specialize in brain tumors and brain cancers.
And then how did you end up in Hagerstown at Meritus?
Yeah, basically it's family. My family is in Pennsylvania, about 3 hours away. Before that I was in Ohio, it was about 7 hours. And then my wife is also a physician. She's an ophthalmologist specialized in cornea. Where I was practicing at the time, it was not a good fit for her where she was practicing. So we basically moved together where she found a good place for her and a good place for me at the same time.
This might be a silly question, but I'm just curious. Do you ever get nervous when you have to perform a brain surgery, or are you able to, with so much time, and obviously you've been in the field for quite some time, is that gone at this point, or do you always have a little bit of nerves?
Yeah, you should have some nerves when you're doing something more complex. So there are surgeries that we do that's kind of very routine, that's kind of your everyday bread and butter, so it just becomes rote, like, oh, I'm doing the same thing over and over again. You don't get so much nerves from those, but every few weeks or so, you have something a little bit trickier, a little more challenging, or more complex. So there are surgeries I do only once a few times a year, that are sometimes a very complex case, and I'm worried about a certain structure, something that pushes beyond or pushes me at my limits of what I can do, what I can't do. So you may hear there's certain things that are operable or inoperable, right? And it actually very much depends on your surgeon and their training. So
Right.
something that's operable or inoperable for one doctor may be not the same for someone else. So how I am now versus when I started in 2018, so different, right? A surgery I do now, to me, that's not challenging, will be really difficult in the beginning,
Right.
but you keep becoming better and better. So there are still surgeries that I'm still a little bit, I had to really, really prepare. I study the scans multiple nights before. I think about the best surgical strategies. And during surgery, before surgery, I rehearse the steps. Then I still get a little bit, I get very tense at certain points. So, if you hear about people doing surgery, they'll say, oh, sometimes they play music.
I was going to ask you, do you have a song that you listen to?
Right. So I don't have a song, but in surgery we have music. People play music to get in the zone or just relax. Part of the surgery, no music, 100% focus. And people will be chit-chatting, sometimes making jokes. When we're doing something that's very easy, very rogue, like suturing at the end of the surgery, we're just kind of relaxed. But there are part of the surgery where you say, no quiet, no speaking, absolute silence when you had to really focus. So, I hope that answers your question.
When you do a brain surgery, do you normally have the same team that you're working with? And so you kind of get this flow and comfortable with the team?
We have a neuro team where the team, the scrub techs, the OR nurses are the ones who are very familiar with the procedure, who are familiar with you, so that it becomes very, very, coordinated. I take my hand out, they give me the instrument, they already know what I want.
Right.
Versus somebody who's not familiar, they may not be so quick to react, like if I have bleeding, if I need certain instruments. So definitely you want to have a team that is adapted to your surgery, to you as a surgeon, and the more you work with them, the better you get.
Do you mainly do brain-related cases and also spine injuries as well? Do you do a mixture of both?
Both.
Okay.
Yeah. Just because people who need spine care is far more than people who need brain surgery. But spine conditions are just so common. People with back pain, with neck pain, sciatica, herniated disc, problems using the arms and legs because of spinal cord compression from arthritis of the spine. It's just much more common.
Right.
Yeah.
There's a lot of fear and misunderstanding around surgery, I do suspect. What are some of the biggest myths that you hear about brain or back surgery?
Yeah. Let's do one at a time. With brain surgery, right? People are automatically very afraid. They get diagnosed with something like a brain tumor. Let's say a benign brain tumor, very common. And the treatment is a lot of times actually no surgery at all, just observation if it's not causing symptoms or small. But if it's causing symptoms and is large enough, we recommend actually removing it, and that will cure you. And very frequently, if you have a condition, the treatment is, here's a medication for the rest of your life. Right? With surgery, the cool thing is you can cure people.
Right.
But then people are like, oh my gosh, you got to cut my head open?
Yeah, I can
I
imagine.
don't want to do that.
Yeah.
If I don't have to do it right now, I'm not dying right now, just leave me be, right? So it's very scary with that idea of cutting the head open. But brain surgery has been done for a long time, and we do them very safely. The risk of dying is almost never heard of from elective brain surgery. I'm not talking about emergency, someone who has a brain hemorrhage, but the risk of strokes or hemorrhage is extremely, extremely low. And people have incisions that are very small, and we don't have to shave a lot of hair, so that they stay in the hospital maybe 2-3 days, and they go home sometimes, and then they have a very good recovery. People are worried about, will I be the same person after surgery? Will I have brain damage? It depends on the tumor or what you're trying to address. There's definitely risk, but the risk is very, very low with modern techniques. We can use things like computer guidance, stereotactic guidance. It's almost like a GPS for brain surgery. Because as regular surgery like belly surgery or other kind of surgery, you can look around and take a look at the belly and look at the guts and liver. You can see everything. Inside the brain, everything looks the same. There's no difference between the brain that lets you talk and the brain that lets you move. It's exactly the same. There's no real landmarks besides some major ones, but sometimes that's why we use computers and stereotactic navigation like a GPS system to perfectly, precisely make incision or target where you're going to go precisely. So you have a very, very fine targeted surgeries rather than exploratory surgery.
Wow.
Yeah.
I can't even imagine what kind of technology is probably still.
It's been out there for decades. It's not even new technology.
Wow.
Yeah.
That's it's interesting, and it's nice to hear you say that. I obviously I've never had brain surgery, but those words, if that was said to me, would make me very, very nervous.
Right.
So those are that's good information to know, because I'm sure as soon as people hear that, it's it's your brain, it's the control of your whole body.
Right. People are usually, I'm sorry to
No, go
interrupt.
ahead. No.
People are usually amazed how good they feel after brain surgery, because they expect a lot of pain. They expect to come out okay, right? They expect, will I come out of brain surgery?
Can I still talk?
Will I talk? Will I move? Will I wake up? Some people are just afraid of the anesthesia. Well, anesthesia is one thing, but now their brain's opened. Will I wake up the same? And most, 99% of people wake up the same or much better than how they are, because the problems causing the brain problem in the first place, many times like a brain tumor, causing paralysis, trouble talking, seizures, immediately they start feeling better. Some people feel like the whole brain has changed. The mental fog has changed. They feel like a new person.
Wow.
Not to say the brain surgery is going to cure all your problems, because people have other conditions like depression and anxiety. We can't cure those things by cutting into it, but we can cure specific things that are causing brain conditions. So you had to talk to the doctor about that.
I'm going to switch gears just a little bit here. Medicine is, as we said, it's always evolving. What are some cutting edge treatments or advancements that you're seeing right now for things like, you talked a little bit about brain tumors. What about Parkinson's would be what I'm curious about.
Yeah, so Parkinson is extremely common. It's as common as Alzheimer's.
Is it?
Yeah.
Interesting. I did not know that.
And Alzheimer's is just dementia, and the most common form of dementia. But there's other type of dementia. But Parkinson's is when people are having trouble with their movements. They are stiff. They are very slow. They fall a lot, and they have the tremors. It's very common. People live with it undiagnosed for many years until it becomes really obvious, the tremors. But they have the other symptoms. But one of the standard treatments people don't know about is DBS, or deep brain stimulation. It's a surgical procedure where implants are put in the brain to basically stimulate the part of the brain to shut off some of the abnormal signals, so people are not having so much tremors. But what most people think about Parkinson's, you take a pill to help with that condition, and then most people don't realize is that there is a adjunct to that, which is a surgery or stimulation. No surgery, no part of the brain is removed. We don't cut anything. We implant this electrode into the brain, and it's actually a very minimally invasive technique, and doesn't have to be there permanent, but usually it's meant to be permanent. But it significantly helps with some of the symptoms, because after a while the medication stops working, or they start having side effects. So neurologists will tell you, hey, this could be an option once the medication stops working. But most of them don't realize is that if you wait so long after 5, 10, 15 years, and the medications are really, really bad, people are having such horrible quality of life, then you do the surgery, it doesn't help as much as if you do it early on. People have much better quality of life early on.
Interesting.
So it's brain surgery, but it's been available for decades.
And is it a fairly common procedure,
or
a routine procedure?
Yeah, it's a routine procedure, but it's just not widely known. And it tends to be done in more major academic centers like university hospitals, less so in a community hospital. People just don't know about that so much. And people are not, they're not known that it's something that should be done. People are still very afraid of the stigma of brain surgery. They're always thinking of brain surgery or any surgery as a last resort. It's one of the myths of surgeries. Do surgery only if you absolutely have to, just because of the risks, right? But sometimes you need to do surgery early on to stop the disease from getting worse, early intervention.
Is there any kind of cutting edge technology or anything similar to what you were just discussing with Alzheimer's and dementia?
Yeah.
Is there anything like that on the horizon?
So there are some new medicines out there that are designed for people with early mild cognitive impairment or early Alzheimer's, that can slow down the Alzheimer's.
Okay.
Yeah, that's been out maybe only a few years. Before, there was no medicine that made any difference. It helps with the symptoms, but there are certain medicines that sort of, they're kind of antibody medicine, or they're monoclonal antibodies that targets a certain pathway in the Alzheimer pathway to slow down. And that's relatively new, and you should definitely talk to the neurologist about that. They're kind of new, they're kind of expensive, you had to do the testing, but there's always new things coming out.
Alzheimer's runs extremely high in my family, and that has always been a fear that I have. Is there anything that people can do at home to protect their brains?
Yes, that's a really important question, right? And I want to talk a little bit more about other things, but you know, Alzheimer's is a complex disease. We don't know exactly why it happens. And I'm not an expert. I'm a surgeon, so we don't typically deal with Alzheimer's patients. But from what I do know is that the bottom line is that there's many small things that contributes to a cumulative effect that contributes to Alzheimer's. A lot of things is genetics, but the main thing we see is something called amyloid, or beta amyloid. It's a waste product in the brain that people make as just normal everyday living. We make waste, like we go to the bathroom, that's waste. The normal cellular metabolism creates waste, and this protein builds up in the brain and just kind of clogs up the brain function. And one of the problems is that this protein is not being gotten rid of. It's just being piled up in the brain. So one thing that prevents that protein from being piled up, the simplest thing to do is getting enough sleep.
Really?
Yeah. I'm going to tell you of 3 things that are totally free. You know, you can take as many supplements you want. You can get the best exercise program you want. You can get the best coach you want. You can buy all the things you want, but none of them are as good as these free things. If you don't get enough sleep, your body, your brain doesn't get rid of that waste, does not get rid of the amyloid. So you can take magnesium, you can take all the supplements. None of them is as good as getting enough sleep, because that sleep time is where the brain actually circulates and get rid of that waste. And that's been associated with, if you don't sleep well, what do you feel the next day? You feel groggy.
Yeah, foggy, tired.
Right, and there's a reason for that. And there are experiments in animal study that shows that clearly, even in humans, that the amyloid builds up in their temporal lobes after 24 hours of not sleeping. And you want that to be cleared up. And the temporal lobe is a frequent area where people develop Alzheimer's in that part of the brain.
Is there any way you can test to see if you have an abnormal amount of that protein, or is that something you just find as you move on in life?
Yeah, so there are scans, like PET scans, that can detect these kind of abnormalities in people with Alzheimer's. That's one of the way to diagnose Alzheimer's. A neurologist will ask you questions. They may get a neuropsychologist, neuropsychiatrist, to go through a battery of questions to determine if it's Alzheimer's, if it's other type of dementia, like Lewy body dementia or frontotemporal dementia. And then these tests will confirm that. But it's not a test you order unless your doctors suspect that.
Right.
Yeah.
And that would be, I mean, I'm assuming the telltale signs, forgetfulness. Is there any other big sign that would be alarming other than just the forgetfulness?
Yeah, forgetfulness comes with aging. Everyone will get some degree of normal decrease in function, sharpness. Telltale signs of it's not so much that they can't remember long-term memories, right? It's not that they can't forget who you are. When it gets really, really bad, people don't even talk anymore. That's our end stages. But they can't make new memories. That's one of the things, that they can't make new memories. But when it gets really advanced, they forget old things. They don't remember who they are. They get disoriented. There are days where they're sharp and days are totally confused, up and down, right? So that's kind of like in people who are getting older, it's hard to tell, are they just getting older?
Right.
Or they're getting demented. But everybody's brain will start shrinking as they age, and what we don't want to see is that they get really bad really quick. And that's why I want to bring up something where there are people who are doing fine, and suddenly over a few months, they are totally
So
different
scary.
overnight.
So scary.
That's called rapidly progressive dementia, which is a separate set of dementia where they suddenly go from pretty normal to really bad very fast. That's not normal. That's pretty uncommon. But about 10% of those disease cases are caused by something called normal pressure hydrocephalus, condition where the brain is making too much fluid or not absorbing the fluids in the brain. We have water in the brain normally. It surrounds the brain and spinal cord. It's like the brain's floating on the water. And the subset of patients, they develop a problem where they cannot absorb the water. So the brain actually dilates and there's too much water. And the water part of the brain helps circulates, get rid of the waste too. So the waste gets built up. And the treatment for that actually is surgery, brain surgery. And we put in a catheter and drains the water from the brain into the belly, and the belly absorbs the fluid, and people start walking normally and start talking normally again. But the main thing is they can't walk anymore. That's called normal pressure hydrocephalus, or too much water in the brain.
Wow.
Yeah. Most people don't know about that.
Absolutely not, yes. When you said about getting a good night's sleep, I think everybody has a varying degree as to what is considered a good night's sleep. What do you recommend for the average adult? What is a good night's sleep?
Right.
Is it 8 hours or?
Right. Yeah, so there's a lot of studies about that. In general, 7 to 8 hours seems to be a good number. There are studies that shows that below 6, people are doing worse. Below 6 hours, they have more risk for things like dementia or other kind of issues. But typically 7 to 8 hours is for the average person just fine. You don't need to sleep extra, meaning if you are haven't slept for several hours or sleep deprived, extra sleep makes you feel very regenerative, but there's no need to sleep extra. For example, let me try to prevent Alzheimer's. Let me sleep 9 hours a day, or 10 hours.
Right.
There's no study that showed that. Right. Okay. Yeah. But the important thing is that 7 to 8 hours is good quality sleep. What does that mean? You can't be waking up constantly because of noise or something's happening outside that wakes you up. If you're a doctor and you're on call and you're getting woken up like a resident doctor by a pager, your 7 to 8 hours is really like 4 or 5 hours. Right. That's not good. And then you need to have enough deep sleep. The deep sleep is very important for restoring, very restorative. It's helpful for memory consolidation. So high quality sleep. And then what's another thing is people don't know, or they don't seem to be as aware, are things like sleep apnea. A lot of people have undiagnosed sleep apnea. People kind of stop breathing shortly, and then it's a risk factor for the same problems. If you don't get enough oxygen in the brain, you actually develop a lot of other chronic problems like lung problems, heart problems. And when you're not getting enough oxygen to the brain, you're getting deprived of oxygen multiple times at sleep time, and during that time you're not getting restorative sleep. So sleep apnea is a big thing.
Absolutely. Yeah. And there's probably a lot of apps you can download on your phone to help you to figure out what is your sleep looking like.
Right.
And I don't know how accurate all those are.
That's the thing, is we don't know how accurate that is. But if you talk to your primary care doctor, right, daytime sleepiness, even though you're getting a good number of sleep, if you're getting 8 hours of sleep, but for some reason, without too much stress, too much work, everything is perfect, but you're just so sleepy in the daytime. That's one of the signs of maybe you're not getting good sleep at nighttime. Snoring, those kind of things. Again, I'm not a sleep expert,
right,
or a because those are treated by neurologists who specialize in sleep, or pulmonologists who specialize in sleep. But from my standpoint, it's very important for the brain health. Good sleep, So good sleep, free. You don't need to buy anything.
Right.
Another thing is exercise. Exercise is free. You don't have to go to the gym or get a gym membership, but jog. If you can't do that because of knee or back problems, people a lot of have that. Walking, that helps with your general health, helps with brain function. And then the other thing is, what people don't value is being in a social situation, loneliness.
Really? Okay.
People who are lonely tend to have worse outcomes in their health. People who are married are doing better than single people. There's many reasons for that, but if you are socially active, if you have a good social network, friends, family, people live better, have better, longer lives than people who are by themselves. And it's multifactorial, but we think that the interaction stimulates the brain, keeps the people healthier longer, keep the brain engaged. And the other thing is, for example, hearing loss. A lot of older folks have hearing loss, and the hearing loss is actually a risk factor for dementia. And there's studies that shows by treating the hearing loss with hearing aids, people actually have less, they actually are more protective for dementia.
Wow.
Yeah.
Well, what do you think about stimulating the brain with things like puzzles or
Exactly.
or is that also something beneficial?
Those are very beneficial. Puzzles, do the puzzles with friends, not by yourself.
Right.
But all those things that stimulate the brain, keep the brain engaged, seems to help. Because it takes a long time to see the changes. It's sometimes hard to do those studies. Those studies we get to see, start in the beginning, then we try something and see the result.
Right.
But this takes years.
Sure.
So sometimes we don't have those studies to prove that. But we know in people who have brain damage or brain injury or brain surgery or brain tumors that has caused brain damage, the more you train the brain to rehab the brain, the better they get better. But versus if you're laying there and not getting training or not engaging your brain, you're not recovering.
Right.
And those are kind of almost intuitive, but you don't even need a study to show that it's working.
Sure. So the 3 free things to help with the brain. Exercise, and it doesn't have to be, you don't have to go to CrossFit, just something to get out there, get moving.
Yes.
Sleep enough.
Yes.
And social.
Yes.
Okay. And that's wonderful. And this has all been incredible information. Is there anything else that you'd like to share about neurosurgery, brain, that we haven't discussed already before we wrap up?
I would say that I really love this, the neurosurgery, brain surgery, and spine surgery. I think we didn't talk too much about spine surgery, and most people think about spine surgery as a last resort. If you have a spine surgery, you'll never be the same again. You want to wait till all else fails before getting under the knife. But there are times when you need to do that early. If the nerve is being compressed, you can have nerve damage, or the spinal cord is being compressed, you're losing the ability to walk. You want to intervene early before it's more chronic, permanent damages. So some things need to be treated early. And because of newer techniques and newer technology, we can do these surgeries minimally invasive. Small cuts.
Right.
Sometimes we can even use a camera to go in there. People can walk out of the surgery. I have patients who literally come to me limping in pain, and the next day or the same day, waking up from surgery, walking out of the hospital, no limp, because of something simple like a herniated disc. And so every situation is different. You have to, get the information, talk to a doctor, and get different opinions. And understand what's happening. You had to understand what's going on with your body, and not just the doctor told me I had to take this medicine for the rest of my life, or a doctor told me if I do this surgery or else. You had to understand and empower yourself with this information, and then you can make better decisions for yourself.
And I would say also get second and third opinions.
Absolutely.
And just make sure that you're talking to as many people as you can.
Yeah.
Well, I really appreciate all the information you've shared today. This has been incredibly enlightening. And I hope I never see you on the table, but if I do, I will completely trust you. I hope my brain always stays nice and healthy, but if I ever have to have brain surgery, I feel very confident with you with the scalpel.
I appreciate that.
Thank you so much,
You're
Dr.
welcome.
Shin.
Great meeting you.
Yes, you too. Thank you.
If you'd like to be featured on an upcoming episode of Let's Talk TriState, call 717-597-9200 or email letstalk@921thegoat.com.